Hi, I'm Colleen Burns, licensed psychotherapist and integrative health counselor and founder of Restore Body Balance, where I combine psychology, biology, and neurology to enact changes that stick. Today, I'm going to be talking about a sensitive topic, but a pertinent topic, which is COVID-19, the coronavirus, and the impact of stress not only on ourselves but our immune system. And today's information is copious, right? And so I'm speaking strictly from my expertise in stress management. So if I look at my certification through the Benson Henry Institute at Mass General Hospital in concert with Harvard University Department of Psychiatry, I learned there the stress-based response and also how to elicit the opposite of that, which is the relaxation response. So let's talk about stress. And really, it impacts every part of our body, even to a cellular level. Stress can influence how the immune system basically responds. And so what happens is when we have a stress-based response, like today's environment, we have an inflammatory response as well. And here, that inflammation is playing a major role in how we respond to potential invaders or injury. During periods of this inflammation, what happens is that the blood gets infused by particles, proteins, and enzymes, and they're there to sort of speed either healing of that injury or wound or to sort of ward off potential invaders. Now, if we truly get sick, hooray for our immune system. If we do need something that may be a cut or an injury, we do need that inflammatory response, hooray, our body is acting exactly the way it's designed to do. The one thing we don't want to do is hang out in that stress-based response because we don't want that constant, what we call allostatic loading or oxidative stress on virtually every part of our body. Allostasis is being able to go in and out of that stress-based response. So when we look at ways that we can antidote the stress, we do the relaxation response. So that's getting from that sympathetic fight or flight to rest and relax, rest and restore, rest and digest, rest and reproduce. Basically everything we want to be doing to function optimally as a human being, we want to be doing in the parasympathetic nervous system. But I'm assuming that most of us are in the stress-based response right now. So let's just dive a little bit deeper into what that means. So during this period of inflammation, right, we're just looking at stress, but also perceived stress. We as human beings have this habit and wonderful ability, unlike other animals and mammals, to basically perceive. And once we perceive a threat, we start to predict and we start to plan. Now, that's also leading into my next topic of anxiety. Stress is different than anxiety. A stressor is we think there's stranger danger. We get into that fight or flight, blood rushing to our fist to fight or our feet to flee, but then the danger passes. Or we hit the brakes or run for the train. A little bit of stress is healthy and it actually can be helpful. Again, we just don't want to chronically be hanging out there. And that's that allostatic loading or that oxidative stress. And that also can compromise our immune system. So let's look at ways we can actually start to antidote stress. So for example, our amygdala, that wonderful little almond nugget in the middle of our brain, is responsible for that fight or flight response. And it is like your smoke detector in your house. It does not know if you've burned the toast or if your house is burning down. It just knows that on and off button. So it's up for us to really have that perception of how we're not only receiving but perceiving that threat and that stress. So what I've said to clients along the way is it's almost like that smoke detector goes out and you need to vacate the building. But the fire department comes and says, you can actually go back in the building. We've checked, there's no fire, it was a false alarm. Well, we haven't been given that go back in the building. So we're all hanging out in that stress-based response. So we're saying or telling our amygdala, nope, I don't believe you. I don't believe you. I'm not going back in the building. And right now we're told, don't go back in the building. But we're also being told ways to keep ourselves safe with social distancing, a proper way to washing your hands, which is tops and tails, soap, and 20 seconds. They say sing happy birthday twice. And also quarantining yourself if you're infected or you might think that you're infected or you've come in contact with somebody. So we do have tools. We do have tools to stay safe, and we're trying really hard to stay safe, I know. But again, it's that perception that we're not safe. So when I go back to my analogy, I'll say to my clients, it is like we're needing to tell ourselves, not the fire department, that you can come back. We can come back to baseline. We can come back to that parasympathetic nervous system, that relaxation response that I've talked about before. Again, we need to tell that amygdala, we need to tell the brain, it's okay. We're gonna be okay. So epinephrine back in the building, norepinephrine back in the building, cortisol back in the building, adrenaline back in the building. I see you over there, get back in the building. So this is the important piece today, because there actually is a difference between anxiety and stress. The stress-based response is saving our lives. We just don't want to hang out there. And then the anxiety, again, is that perception. And because when we, as humans now, we've determined, unlike other mammals, we have the ability to experience anxiety, but then to predict and plan. And that's what we're experiencing as a global pandemic, is the perception of how is this going to impact me? How is it impacting my loved ones? How is it impacting my finances? How is it impacting my lifestyle? So let's get to how we antidote some of this stress. And I'll give you a few examples that I use in my office that you might have lying around at home. So today I happen to have Hershey Kisses. And I learned this at the Benson Henry Institute for the stress management and resiliency training that I'm certified to teach. They actually ask you to take a Hershey Kiss and just let it dissolve in your mouth. And you use those senses. So it's, what do I smell? What do I feel? What do I taste? What do I hear as I take that wrapper apart? And it's very difficult, believe it or not to bite into a Hershey Kiss. We just want to let it dissolve. But we can do this with anything. You can do it with a cup of coffee. You can do it while brushing your teeth. I love to tell my clients this idea of just brushing each tooth. You will have many intrusive thoughts, and you just say, I'm going back to brushing my teeth. And that actually is what mindfulness is, and meditation. It's just training the brain to come back to the present moment and stopping that allostatic loading, or as I say in my book, Prescription for Change, going down the rabbit's hole. And taking something that we habituate every day is why I call my practice Restore Body Balance, because we're combining the psychology of the mind, which is what I've studied for 18 years, and then also the biology of the body, which goes to my nutrition and health coaching certificate in integrative medicine. And then also, lastly, the neurology, which I learned from the great Dr. Herbert Benson at MGH and the Benson Henry Institute, is that we actually need to be antidoting the stress, and we need to be doing this multiple times a day. So let's go to something like a cup of coffee. If we learn to habituate things like morning routines, bedtime routines, and then anything in between, especially while we're unfortunately not necessarily sheltering in place, but we're spending more time at home, there are things that we can do to keep our routine. And if we incorporate some mindfulness during each routine, again, using the 5 senses, potentially with a cup of coffee or an afternoon cup of tea, not to mention if we're having green tea, all of those wonderful antioxidant properties. We can even do that, even washing our hands that we're reminded to be doing a million times a day. We can turn that into just an activity where we're just present. okay? We're present doing what we're doing, and we're keeping ourselves clean, and it's hygiene. We can turn really anything into a mindfulness moment. So let's talk about other ways to antidote stress. Just taking a deep breath. 2 deep breaths, even better. In through the nose, holding it. Out through the mouth, even better. Look at Dr. Andrew Weil's YouTube video for his 4-7-8 breath. It's amazing and it works. I've been giving that away for years. I adore Dr. Andrew Weil, true pioneer in integrative medicine. And why this works is you're actually, when you take a deep breath, especially through your nose, the part of the nose that actually goes down and it is aimed right at your diaphragm expands as a parachute, and it actually trips the vagus nerve, which puts us into the parasympathetic nervous system of rest and relax, rest and restore, rest and digest, and rest and reproduce. Another way we can do it is like the Hershey Kiss. Most of us have a morning cup of coffee, or we can teach our children or younger folks to do this with any activity that they're doing during the day, whether it's preparing breakfast, having a bowl of cereal, having their toast or eggs. But get the 5 senses engaged. What am I seeing? What am I tasting? What am I hearing? What am I touching? What does this feel like? And speaking of, rest and digest, right? So as an integrative health counselor, I see a lot of people with GI issues. And I'm sure right now, people that are going into that stress-based response are having stomach aches and maybe, some acid reflux because we're in that fight or flight response. So let's remember, we have tools, we have ways to get unstuck. Another thing that we can talk about is looking at ways to be supportive to one another, right? For those people that are isolative, we need to look at how can we support one another? How can we check in with one another and stop panicking and trust the process? This is certainly a time of the unknown, and the unknown makes the amygdala say, I don't know, I better stay in that stress-based response. And when we find ourselves getting tense, tensing our jaw, furrowing our brow, being short with our significant others, me today, we're all doing the best we can, but practice good hygiene, practice social distancing, washing our hands, doing everything that we're instructed to do. Like I said, the CDC and WHO, Center for Disease, and the World Health Organization, the National Institute on Health. There's lots of organizations we can go to, but most importantly, be kind to others. And if anybody has any questions, please feel free to email me through my website. I'll do my best to respond to everybody. Subscribe to my YouTube channel, again, Restore Body Balance. And I look forward to my next YouTube video where we're going to be talking about that social distancing. So take care.